thank you so much for being here with us today, and congratulations on your new role.
Thank you, Mark, very much. It's a pleasure to be here.
I understand you're a local, and you're also a huge Cubs fan, so I'm excited that we could be here in Chicago with you today.
Thank you very much.
So I'm just going to jump into a couple questions.
Sure.
And my first question is really about the changing demographic of today's dentists. So as you know, we have more and more dentists that are part of Gen Z or Generation X, and they're digital natives. They spend more time on Instagram than they do perhaps watching television. So how do you envision engaging them in a trade show format? What does the trade show of 2030 look like?
That's a great question. I think it's going to look similar to the one that we went to in Cologne in 2017. Everything was all digital, high tech, 3D printing, all technology. There weren't, now granted that meeting has no classes, everything was geared towards lab work, implants, 3D printing, all types of technology things that are happening today. I taught at Midwinter for 6 years. The students are very in tune with Cerix and iTero machines and digital pans and everything that's not written, not old x-rays. This current group now of men and women and all cultures and all countries is used to technology and from the front office to in the operatories.
That's great. And with many of the technologies that you mentioned, 3D printing, Cerix machines, there's really a desire, I think, by today's dentists to touch and feel those machines, to actually see them hands-on.
Yes.
Would you agree?
Absolutely. And that's why these shows are important. Even though you can go on the internet and look at things, you need to come to these shows to experience those things, to play with the machines, to practice, to figure out what best suits your needs for the office.
Oh, that's great. So speaking of change, you've seen this industry and dentistry change over 3 decades. What is, to you, the biggest change that you've seen over your career?
It would be in those areas of things going digital, hand pieces being fiber optic, the equipment, the materials have changed tremendously, okay? The art of dentistry is the same. You have to have your heart and your hands in the profession, but all the things that are there allow us to be much better providers to patients based on all the new stuff that's available now.
How do you think that's changed how dentists learn and discover and understand how to use that technology? Because it might not be something that's inherent to learn that technology, or to what degree it might be taught in schools.
The students, interestingly enough, were more comfortable looking at a YouTube video than watching an instructor do the work themselves. This generation is taught differently than we were taught. So, whereas the end product is the same, I think it's a better thing for them because of the technology. The computer doesn't lie. So things are more accurate, more true, and I think you become better dentally by having somebody else. There's a third party watching your work. So I think for that reason the work becomes better. So I'm excited about what's coming up in the future.
Absolutely. I have to imagine that change also means the way that education, but also continuing education, and the way that we collectively engage with dentists has to change as well, particularly if they're more comfortable learning from a YouTube video than say in a live course.
Right, and that's true not just at the exhibit floor, but for the courses we have. 25% of the courses this year are an hour and 15 minutes.
Okay.
The graduates 5 to 7 years and younger do not want a 3-hour or a 6-hour class. They want an hour and 15 on how to remove a crown, how to take out an amalgam, things that maybe they didn't learn in dental school. So we are trying to adjust with the needs of recent graduates.
Oh, excellent. So there's a very interesting change happening here this year. What does the word kaleidoscope view mean to you, and how does it apply to the changes that you've witnessed over the years?
Dr. Tiersky, who was a classmate of mine, chose the kaleidoscope view because this year being 2020, a lot of the themes are vision. Her vision of the kaleidoscope is that dentistry is similar to a kaleidoscope in that you can look at something once, but the minute you turn the dial on the kaleidoscope, the vision changes. And it's the same in dentistry. Like we talked about, the equipment, the instruments, the supplies, everything has changed in the last 30 years. From Sylar and Silux to composites that cure without a shade guide, everything that's been done. So that was her genesis for the kaleidoscope.
Oh, very interesting. How do you think that that's impacting the way that dentists treat? You mentioned earlier that the basics, the fundamentals of being a dentist are the same, but does this technological change also influence the way that doctors are treating patients?
I think the communication with the patient is the most important thing. That's your bond with them. You decide the treatment together. If a patient goes up to the front desk and says, I don't know what treatment I had today, then you're not doing your job. You need to discuss all options with the patients, from nothing, from implants to fixed, removable, and make that decision together. And then explain to them how the technology works so that they understand what you're doing.
Do you think technology is helping dentists do this more effectively, to
Yes.
engage the patient and have the conversation?
Absolutely, especially this generation who is dependent upon this.
That's good. In what ways do you think that is? Is that through visualization, or how are dentists able to engage the patient in that treatment planning
I
process?
think as a dentist, it's easier for me because I can see the process as it's happening,
Yeah.
and I can also explain it to the patient because they can't always see in their mouth. So when you show them a cracked amalgam or they see a crown prep, it's easier for them to visualize and understand what's going on.
Excellent. So imagine that you're speaking to every young emerging dentist in the country right now. What are the 3 most important things that you would tell them?
Find a good lawyer, get a good wife, and have a nice accountant. No, I would say the first thing is get as much and as frequent continuing education as you can. Whether it's on the floor or in a classroom, you have to be learning constantly. Number 2, I think the second biggest thing is communicating with your patients. You need to talk to them about what you're doing, what you can do, what needs to be done, and so forth. And the last thing I would tell, and I used to tell the student, was know your limitations as far as what you can do and what the limits of your materials are. You know, if you're not comfortable doing endo, then don't do the endo. They have endodontists for that, oral surgeons. Be comfortable in what you want to do and be very good at it.
Is that an emerging trend that you see? You see that more dentists, young dentists, would like to offer more specialty treatments?
Yes.
Okay.
I think the way they're being taught now is to be super dentists, super generalists, where they can do a lot of those procedures. If you live in a small town in a rural area, you may have to. The closest endodontist or oral surgeon might not be 2.5, 3 hours away. So that's kind of where things are going.
Okay. Do you think that education and technology play a role in kind of enabling the young dentists to get into more of these specialty procedures?
Yes.
Okay.
Yeah, absolutely. I think especially for this generation who is so technology dependent, it's a must. When I took my DAT exams, we had to wait 6 weeks for the results. The students that take them now get the results on the way out. So everything has changed, you know, for the better, but the relationship with the doctor and the patient has remained the same. The making somebody feel comfortable, letting them know how you feel, what you're going to do to them. Okay, that you can't take away. Everything else around it may change, but the one-on-one with the patient stays the same, and that's the best part about this job. I love it.
Oh, that's wonderful. Dr. Nicholas, thank you so much for joining us today. I really enjoyed our conversation. Appreciate you being here.
My pleasure.
Thank you.
Thank you.
Thank you very much.